Sihat beyond the clinic, kesihatan everywhere dari rumah ke community, showing people that we...
Hi everyone, welcome to join us today in our first podcast recording. This podcast is called Sihat Beyond the Clinic. It's a startup. I'm the producer. I'm Dr. Vicky. My full name is Dr. Vigneswari Subramaniam. I have a few co-directors to the podcast. So allow me to introduce Dr. Rutresh Rao Subramanian,
Hi everyone. Hi.
Dr. Ruta Shini R. Selvasingam,
Hi everyone!
Dr. Amir Imran.
Hi, happy to be here.
So this is a podcast where it is a platform for us to discuss anything to do with health and wellness. And the topic of our first podcast is called Stunted in the City. Why are urban Malaysian children still not growing well? So my very Malaysian Indian mother would completely beg to differ with this topic because in her point of view, no, my children has grown very well. I fed them very well. They're well nourished. They're all round and healthy. So why are you using this topic? This is an enlightening session for parents who have children out there who are schooling or homeschooled. Please stay tuned. So when we hear the word stunting, many of us imagine rural poverty. We picture underdeveloped areas or extreme deprivation. So we feel like, no, Malaysia is out of it. We are quite well fed. We are quite well nourished. We are a country with abundance of food. And it's also easily available to Malaysians out there. However, stunting is happening in urban Malaysia. This is shocking. Among children living in apartments, going to school, growing up in modern environment, this is occurring as well in Malaysia. So this discussion is not about blaming anybody. We are not here to blame parents or the schooling system or even the nutritional system per se. So this is about other systems. We're discussing systems as a whole. We're discussing food environments. We're discussing policy gaps, and we're discussing everyday realities and why urban stunting is a silent crisis that can get worse. So Dr. Ami, over to you. What is stunting?
Stunting, or as we call it in Malay, bantut lah. So according to the WHO, stunting is impaired growth and development that children experience due to poor nutrition, repeated infection, and inadequate psychosocial stimulation. So how we measure it is using the height for age. So macam untuk umur dia tu tak cukup tinggi lah. So macam mana kita nak classify dia tak cukup height for age tu bila dia di bawah standard WHO atau 2 standard deviations below the WHO growth standards. So in simple terms, the child is significantly shorter than expected for their age compared to healthy global standards.
And children are being monitored, right? This growth is because an average parent in an average Malaysian household would not know what is the WHO growth chart. But is this being monitored at our health facilities?
Yes.
Yeah.
Actually kalau kita nak ukur bantut ke tak, kalau ibu bapa perasan lah, kalau kanak-kanak kita masuk hospital, kita akan diberi satu chart, growth chart yang doktor akan plot tinggi dia dan juga head circumference lah. So that head circumference tu akan bagi kita gambaran lah whether dia terbantuk atau tak. Dan kalau kanak-kanak kan mesti ada pergi check up dekat klinik kan. So that's when they do the measurements lah at the clinics.
Faham. Dr. Ruta, let's say kita ukur hanya height, right? Is it just the height that is concerning us about stunting?
So Dr. Vicky, we see stunting is not really about appearance lah. It's very important to understand that stunting will affect the first 1,000 days, the early development of a child. During this development period, we know that the brains develop, the organs develop, and then the neural forms are connected. So if let's say the nutrition is inadequate, right? So the child can actually have effect on the development of the brain, the learning ability, the attention span, and also the immunity. Okay, here we know that in the urban paradox, people will always say, oh, a child can be overweight and still undernourished because calories are not as same as the nutrients. We always confuse calories and nutrients.
Yep.
A child can be full but not necessarily nourished.
So kepada semua pendengar di luar sana, this is a very important point to note that kita tak boleh lihat the child as just a tall height or ataupun dia gemuk atau dia bulat, dia comel montel or ada pipi pau, okay dia sudah sihat. Actually growth stunting still can occur walaupun dia tak ada semua ni ya. Dr. Rutresh sekarang, I'm a bit surprised that this is happening in cities where food is available and easily accessible and there's a balanced, nourished diet everywhere. So why is this happening?
Dr. Vicky, you brought up a very interesting point. Why is this happening in the cities actually? You know why? Basically, urban life introduces its own risk factors. Okay, you're looking at parents who are super busy. Okay, both parents are very oriented, memang nak jalan jauh. Okay, there's a lot of, time pressure, there's heavy reliance on convenience food. Parents like to go and, get fast food. They like to go to shops and, pack food rather than making homemade food and all that. These are actually some of the risk factors, and children are repeatedly being exposed to, all these processed snacks,
Yeah.
sugary drinks, fried foods, low protein meals, and, even and you'll be surprised, some of the school canteens are also providing the same
Correct.
thing.
Despite available regulations against it.
Exactly, and they know the child has all sorts of token system and the money system and all that. The children just go and they ask for it. Probably
Yeah.
kids are a bit more difficult to tell, and then this is why it's important for us to actually educate the canteen. Those who are running the canteen and the
Yeah.
teachers to actually do. In terms of the nutritional standards and all
Yes.
that. Yeah.
Actually, just to add on also
Yeah.
to Dr. Rutrish, I think today everything is just easily available. It's just on a
Convenience.
click. And there you get it delivered.
Yeah.
Those days we don't have that. We have to go out and look for food.
Correct.
But today you just click a button, it's
Correct.
at your doorstep.
Correct.
And even very importantly, why pergi kat kedai sekarang, see all this bright packaging, we just love it.
Yeah.
You just look at the colour, you love it, and then when you bring your kids, right, your kids also melambang dia punya mata.
Yeah.
Stunting is not about starvation. We're not letting the kids to be starved
Yeah.
actually. It's actually the very poor food environment, very poor nutritional food environment actually.
Yeah. What happened to safety nets? This got me thinking. In the past, when I was schooling, recently, I'm not very old,
But yes.
so no. Anyway, we used to have this thing called Rancangan Susu Sekolah. So they provided
yeah.
free school milk production, distribution.
Used to love those days lah.
Yeah, exactly. So, and it was a very happy time lah. Okay, so a lot of nutritional coverage was being covered by the government sector itself, and then there's a lot of early detection for growth problems because we had this team Pasukan Sekolah. They used to come in and constantly check our heights and weights and all. I think they still do it. They still do it, right?
Yeah, yes, they do.
It's still there.
So these programs approaches kids of various backgrounds. That's the point we want to hit here. That means it's not only targeted those days towards this thing called B40 or Scheme Madani for Group Madani. It's not that. It's actually towards every child. So they cover the nutritional aspect as a whole to everybody, whether they are kaya or not kaya, whether they are not rich. Doesn't matter, they get the free milk. Okay, so today nutritional efforts may be a little bit fragmented, okay, inconsistent, as well as reactive rather than preventive. That means there's nothing going on for prevention, it's more reaction. Dr. Ami, back to you. Children's schools I see there's a missed opportunity. Actually, there's so much of interventions when we speak about children that can be done in the school level.
Yeah.
Okay, so what is your opinion on this?
I think I'd like to follow up from Rutrish's comment just now that parents are busy in urban settings, and where do we leave our kids when parents go to work? School, right?
Yeah.
Yeah.
So how long do they spend time in school? Almost the whole day. As long as the duration that we are working, 8 to 5, maybe earlier or later if
Indirectly, we have to agree. Like, and some parents will be like, okay, the children are at school. You know what? I get
Yeah.
this time to,
Yeah.
Half an hour me time after work.
It can be a nanny free time as well.
Yeah.
A little bit of time. Okay,
I'm
let them
sure
be a bit
the
higher in
listeners
school.
can relate to this now.
Yeah.
But that's when the time spent, kids spend alone with their friends. Are they really filling up with beneficial food? Because it's an opportunity for them to get the better nutritional foods
Yeah.
at school. So maybe I know my kids spend the whole day at school.
Yeah.
Pagi sekolah, petang maybe got kafar or
Yeah.
frontline
Yeah.
or curriculum, whatever,
Yeah,
right?
yeah,
So they eat breakfast, lunch,
Yeah.
probably tea if
Yeah.
they spend the whole day there.
Yeah.
That's
But what kind of food do they eat? Are we going to give them bekal morning, afternoon, petang, like 3 bekals?
That also takes a lot.
Yeah.
We also
Yeah.
skip meals, right?
Yeah.
Breakfast and all.
Basically, all of us are doctors by the way. and skipping meals.
Yeah. So what are the standards for nutrition? Are they consistent or not?
Yeah.
The kids are eating.
Yeah.
And the canteens, do they really want to provide nutritional food?
Or are they just
A business.
Yeah.
The food preparation,
Yeah.
especially if they also want it to be fast
Yeah.
and quick.
Yeah.
But-
They also want convenience.
Yeah. But if it's healthier, does it mean it's more expensive? So I see, at least for some kids, there's fried foods that are
Absolutely.
very popular for them. Lah.
Yeah.
So not just learning school as a place for children should also be part of their nutrition.
Yes.
And kids should also learn, and also us as parents should learn about food literacy
Yes.
and healthy environments.
This got me thinking. There was a recent article by a very renowned health institution that informed that we are not to heat up food in plastics, in plastic Tupperwares and all that in the microwave, because that can be a carcinogenic substance by itself. So it got me thinking, even school canteen providers do this. They heat up food that's pre-prepared. Even we do it at home. So this is a whole different ballgame now. Back to Dr. Rutrish. Why is this not just a problem or at the moment? Why is this a concern? How can this affect our community in the long run?
Okay, so we're looking at this in the long run, okay? This is actually a long-term effect, okay? We are not only looking at the child who's going to have a stunting issue while they're being a child. It's going to be associated with their poor academic performance. It's going to be reduced earning potential in the future for them. High risk of chronic diseases. I mean, we can start on about the metabolic diseases that they're going to have.
And a health burden to our
Health
economy.
burden to the economy as well, and the increase, it's definitely an increase of the healthcare cost. And if you're looking at the population level, right, I mean, this affects the workforce quality in the future. I mean, what kind of workforce are we producing?
Yeah.
What kind of future is the country having? What kind of future are we providing Malaysia? Right?
Yeah.
So that is actually very important in terms of productivity, national development. So stunting is not just about one child. It's not only about one particular school. It's actually a reflection of the entire population. We're
Yeah.
looking at the nation. It's a national development actually. It's measured by how well the children grow. So it's very, very important for us.
The future of any country is depending on how healthy its younger community is,
The
because
younger
they are the
generation,
future rakyat.
Yeah.
So if the future rakyat comes out to be unhealthy, their growth stunted from young, then how is their intellectual capability to produce things that can allow the country to grow further in the future? Dr. Rutha, what do you think can be done at various levels that could possibly allow this to shift?
So if we look at public health interventions, we try to tackle every level lah. So we start from the individual, then we go up to the community and the bigger system.
Yeah.
So when we talk about the community, the parents themselves, we need to provide them with, nutrition literacy. Because with the literacy, they can make informed decisions, they can make right choices. So nutritional literacy is actually like educating the parents,
Okay.
giving them education about the good food, healthy food. Good food not necessarily means healthy food. So healthy food, healthy choices. And we need to have a lot of community-based programs. Sometimes our programs are very targeted to in school, because we take opportunity of like the pasukan sekolah and all that. But we also need to go out and spread this. Then of course, we only cannot target the community and parents. We also need to look at the policy and the systems. So one is our school nutrition program, like you mentioned just now, Dr. Rancangan Susu Sekolah. Now we have Rancangan Makanan Tambahan. But we can always try to cater this for all the students, see how we can actually help them have healthy food.
Yeah.
And then we need to standardize
Yeah.
and have a good enforcement on the canteen guidelines, because these canteen people, they will also listen to us. So
Yeah.
if we can give them the guidelines, maybe they can follow. But when we have a guideline, we need to monitor.
Yeah.
We need to enforce it.
Thank you, Dr. Uta. So what you're saying is the changes has to be at multi-level. Yeah, it starts from the community, from the parent level, the school level, and then it goes up to the political level in policy making, the system by itself. So it's not a one-man show here. Everybody has to come in and do their parts. So consistency is key. It's not just about policy making, but implementing the policy and actually following the policy matters. So if I were to ask each one of you in one sentence, what is your take-home message back to our listeners? Dr. Ami.
I think we pride ourselves in our variety of food. So I think we can do better to provide healthier food for our children, for them to grow consistently with the healthy standards.
Dr. Uta.
So I would like to conclude by saying that your child's health is in your hands, so you have to make the right choice.
Dr. Uta.
I think what I'm going to say is, I think the policy level, if we can plan mega infrastructures 10 years ahead, and we have the second tallest building in the country, in the world, in Malaysia, then I think policy level we can definitely plan a very well fed nutrition for our 2-year-old, 3-year-old, and also for our all school going children in Malaysia.
Absolutely. So a modern country, it's not measured by the number of skylines that we have, but it's actually measured by also how healthy. I mean, the Skylines is there, very good. We're very happy. All of us are visitors to the Skylines. We're supporters. But it's also measured by how healthy its children grow. With that, we conclude our first podcast for the day. Thank you.